Welcome to this video about the Glasgow Coma Scale. Whether you're a medical student on your first clinical rotation, a nurse at a bedside, or a physician needing a quick refresher, understanding the Glasgow Coma Scale is essential. Only a small part of our viewers are currently subscribed. If you're finding this content helpful, consider subscribing. It really helps our channel and ensures you won't miss out on the next videos in the series. Thanks for your support. The Glasgow Coma Scale is a neurological scoring system used to assess a patient's level of consciousness, especially after a head injury or in case of altered mental status. Developed in 1974 by Professor Graham Taysdale and Brian Janet in Glasgow, it's now a standard tool worldwide in emergency medicine, critical care, and neurology. The Glasgow Coma Scale gives an objective, standardized way to assess the depth and duration of impaired consciousness. It helps detect brain injury severity, monitor changes over time, and guide decisions about imaging, airway management, and ICU admission. The Glasgow Coma Scale is scored based on 3 responses: eye opening, maximum 4 points, verbal response, maximum 5 points, and motor response, maximum 6 points. Let's break these down. Eye opening. 4 points for a patient who opens his eyes spontaneously. 3 points to a patient who opens his eyes to voice. 2 points to patients who open their eyes on pain. And 1 point for a patient who doesn't open his eyes. Always ensure the patient's eyes aren't swollen shut or chemically sedated before scoring. Verbal response. 5 points for orientated patients. He knows his name, he knows the place, the time, date, etc. 4 points to a confused but able to answer patient. 3 points to inappropriate words, like random words. 2 points to incomprehensible sounds, like moaning. And 1 point for no verbal response. If the patient is intubated, document V1T or NT, not testable. Motor response. 6 points to the patient who obeys commands. 5 points to a patient who localizes pain. 4 points to a patient who withdraws from pain. 3 points to a patient who does a flexion to pain. 2 points to extension of pain. And 1 point to no motor response. Use central pain stimulus like trapezius squeeze or supraorbital pressure. Add the best responses from each category. The minimum score is 3, and that's a patient in deep coma or deaf, and the maximum score is 15, and that's a fully alert patient. For example, a patient opens his eyes to pain, which is 2 points. Use inappropriate words, which is 3, and withdraws from pain, which is 4 points. You'll end up on 9 points, and that may suggest moderate brain injury. Of course, there's a clinical interpretation of these points. 13 to 15 points is a mild injury. 9 to 12 points is a moderate injury. 3 to 8 points is a severe brain injury, and the patients are often comatose. A Glasgow Coma Scale below 8 usually requires intubation and ICU level care. However, the Glasgow Coma Scale is a powerful tool. It's not perfect. Be very cautious when a patient is sedated or paralyzed, if there are language barriers, if the patient is intubated, or if there's a facial trauma or hearing loss. Always document reasons for not testable responses and note trends over time, not just isolated scores. Some tips for success: use nail bed pressure or sternal rub only when it's needed. Always assess the best response in each category. Practice consistently. Inter-rater reliability matters. Combine Glasgow Coma Scale with other findings: pupils, vitals, CT scan. For kids under 2 years, use the Pediatric Glasgow Coma Scale, which adjusts verbal and motor responses to age-appropriate behavior. For example, verbal with 5 points is cues and babbles normally. Motor of 6 points is spontaneous movement. The Glasgow Coma Scale is a simple, rapid, and reliable tool for assessing neurological function. Whether you're in the ER, ICU, or just on a general ward, mastering the Glasgow Coma Scale is a skill for all healthcare providers. Want more quick and clear videos like this? Hit subscribe, give us a like, and check out our playlist on neurological assessment. Stay sharp and stay safe out there.